Hey everyone. So, how important is inflammation in your health journey? The first picture was my following the standard American diet as given by allopaths and your nutritionists. Okay. Significant amount of carbohydrates. Protein is always about standard, 20% or so. And of course, depending on your specific blood work and things, the allopaths may remove, obviously they'll remove fat just because that's what they do, but they'll also reduce your salt. And it is my experience, I'm not an allopath, I'm not a nutritionist. I am someone who has studied from holistic doctors and doctors who understand how the body works. And in my personal experience, I found that carbohydrates continue to put me on a roller coaster of hunger and binge. And I was 125 kilos in August of 2020, and I followed their diet, and in 3 months I lost, I would imagine, a significant amount of weight. I went from 125 down to 109, and then I rebounded to 112, and there I plateaued for 6 months. I was pulling my hair out. I was doing everything I was supposed to. I was reducing calories, I was walking, I was because that's what worked for me before. And folks can criticize, well, maybe you should have done this, maybe you should have done that. Maybe you should have done high intensity, maybe you should have done weight training, maybe you should have done all of these different exercise regimens, the whole idea of calories in, calories out, eat less, do more. Okay, fine. Valid. And like I said, it did take me from 125 net down to 112. All right, so that's 13 kilos. That's about 26 pounds. I can guarantee you 10 of which was water. And then there we go. Now, the picture that you saw on the thumbnail, the really puffy one, that's 112 kilos. And then the next picture is 107 kilos. So we're looking at 5 kilos. We're looking at another 10 pounds. But what's significant about this is that I had stopped sugar. I had stopped grains. I had stopped the so-called vegetable oils. Which, why do I harp on that? Well, originally these things came, well, they still come from seeds, but major companies at the turn of the 20th century knew that they started producing these oils, and they could be used in motors and in cars. And what we found out is that you could actually remove the nasty flavor, and then they were labeled as safe for human consumption, or generally regarded as safe. I think that's what they call it. So these are USDA guidelines that said they're GRAS, generally regarded as safe. Lo and behold, we know now, here 100 and some odd years later, that there's omega-6 fatty acids and omega-3 fatty acids. And when the 6s are just off the chart compared to the 3s, okay, I'm not going to get into all the stuff. You can look that up on your own. The bottom line is it causes a lot of inflammation in the body. So, for example, some people who have pain in their knees, it may not be the weight on their knees. It may just be the inflammation within the joint itself. So if you remove the inflammation, even if all the weight doesn't come off, you may find some relief. So after the veg oils I got rid of, then obviously the other thing is the refined foods. That's anything that's ground into a powder, anything that has more than one ingredient. In other words, olive oil. Well, that's processed. Yeah, It's literally put in a press and they squeeze it and the juice comes out. Same thing, I can do that with a pecan. I'll take a little piece of pecan and I can actually squeeze it in my fingers and there's oil. And okay, I don't consider that processed. I consider that squeezing a fruit, the olive fruit. Now, depending on which fruit you squeeze, well, that's going to impact your liver, but that's another story for another day. So, cut from there 107 to today about 87. So I dropped another 45 pounds since then. And again, no inflammation whatsoever. And since then, my body's like reformed. So I will have lined up all three pictures. The first one, again, was my following what all, this is what they call standard medical procedure. These are guidelines set forth by somebody somewhere who says if you do this, you can't get sued. I'm looking for the day when somebody does come up with a class action lawsuit and sues the living hell out of the government for their corruption and these allopaths and nutritionists who know better. And the reason I say that is Dr. Fung did come out with a study that said 71% of doctors and nutritionists agree, that is, they did an anonymous survey that said 71% of these people, when they want to lose weight, do a non-medical standard practice diet. And that's essentially taking, okay, let's just call 20% our proteins. All right, let's just leave it there. So what they do is they pretty much relegate fats, salts, and literally fats down to 5%, and then they give you 70% or so carbs. The numbers are close, so don't harass me on the specifics. But what nutritionists and doctors who know better, they reverse that. So they wind up eating about 5% carbs, and then they eat 20% protein, and then they eat clearly 70% fat. But obviously they don't give their patients those diets because they don't want to get sued. What if you gave a patient that diet, and this allopath, who's a legal drug dealer, he knows how to give you drugs, but he really is never taught how to remove them from your life. So if you put somebody who's on a whole lot of blood pressure reducing drugs, diabetes drugs, and you give him this diet, but you don't remove these medicines or keep track of them, literally within a week, he will come up with some very serious problems, because the body within a week can make drastic changes in itself. Once you go through this thing called the Keto Flu, for example, your liver and pancreas and your visceral fat immediately gets dumped as fast as possible. That's what the body needs to do with it. That's what it would have done hundreds of years ago, thousands of years ago. After we gorged on all our fruit, we got really fat, and the fat diminished very quickly as we got into spring. Oh, thank God spring got here. Now we can begin to grow things. We can still hunt. Animals become plentiful. So when you look into the history of stuff, you start kind of leaving behind all this worthless garbage that we hear about today. But like we say in Mexico here, cada quien, to each his own. So today I enjoy a tremendous weight loss, but it wasn't because I tried. I actually just brought my body back into balance, and the weight fell off as a consequence. And that's what I heard from Dr. Berg almost day one, and I didn't quite understand it, but then, it hit me. He said, you don't lose weight to get healthy. You get healthy, and then you lose weight. It just has to happen. Your body returns to a point of its own nature. Just one last little deviation here on the philosophical side. Let's just call it that. Let's forget about religions and such. Let's just talk about philosophy. Without your active brain, and we know this because you sleep, you're unconscious, you don't know what you're doing. There are people who have had severe damage and they have no brain function, but their medulla continues to work. We know the body will continue to do what it needs to do, with or without you. As long as the people, obviously, they have to continue to give your body fuel, but your body knows what to do with it. It absolutely knows what to do with it. So really all we do is really get in the way of our body. So if we can learn that we are body, mind, and spirit, okay, we have an animation that other creatures who move around have, but not quite to our level of mind, which is really an abstract mind. We're capable of creating symbols to mean things. We're able to communicate using some pretty outlandish concepts that no other animal on this planet that we know of can do yet. I guess you can kind of sort of train, like Pavlov's dog, ring a bell, and that tells the dog to secrete stomach juices, and it makes him hungry, that kind of thing. I think we can train animals, but for them to become self-aware, self-actualize, no, humans, so far as we know, are the only ones who can do that. Again, kind of finishing out here, you got to get rid of sugar somehow. You've got to do it. You got to get rid of grains. And I mean grains, like all of it. Bread, flour, pasta, tortillas. I know. Just for a little while. And if you can handle it and reintroduce it slowly, carefully, controlled, that's what you control. And I think you can do quite nicely, eat 2 tortillas with your meal, not half a kilo. And trust me, I did it. I know several people who do it every day. I mean, that's their silverware, for Christ's sake. They scoop with a tortilla. I can copy videos for you if you want to see exactly what I'm talking about. You've got to ignore the vegetable oils. You've just got to get rid of them. I don't know. I personally use lard, butter, and olive oil. And any, obviously, beef juices that fall off beef when I cook it. I always inculcate that in any sauce or anything I make. And after those 3 biggies, the last thing really, just get rid of refined foods. If, like I said, if God didn't put it in a package, don't eat it. And then you, as a bio individual, have to determine for yourself what makes me feel good, what actually doesn't make me feel good, what helps me sleep at night, what doesn't help me sleep at night. And you're going to come to the point where you're going to eat a diet that you literally are like, I eat once a day, maybe twice a day. And then I'm not hungry, so I don't eat. I don't have cravings. And when I'm hungry again, I'll eat again. The body will tell you. It has hormones for that. And so that's my little spiel today. So anyway, guys, you have a great one. It is Sunday morning. I still have half my cup of coffee. Yum. Although I think I'm going to reduce it again. I think I'll bring it down to, I'm now up to 350 milliliters. I think I'm going to kick it back to a standard 6-ounce cup. I think that's 220. Yeah, I'm kind of weaning off coffee. Weird. I mean, my body's like, I don't like it. I enjoy the flavor. I enjoy the cup of coffee with my routine. But, if my body's saying, bruh, no more, then it's no more. All right. So on that sad, happy note, bittersweet note, we'll talk again soon, guys. Bye.